Diabetes can also affect your heart health. Dr. Gary Allen, Medical Director of Cardiothoracic Surgery at Florida Hospital Waterman, explains the role that type 1 and type 2 diabetes could play in cardiac disease.
Diabetes plays a very important role in cardiac disease, and in general there's two types of diabetes, type 1 and type 2, sometimes called juvenile diabetes and adult onset diabetes. Juvenile diabetes is, as it's described, that's a very different type of disease, and that comes from individuals that don't have proper, what we call islet cell function in the pancreas from birth. That's nothing that they did, and that's nothing they have control over. And those are individuals that are diagnosed generally pretty early, somewhere between the ages of 4 and 10, and those are individuals that require insulin. Fortunately, that's the minority of diabetes in the United States. It probably represents somewhere around 10 or 15%. The second type, type 2, which is adult onset, and that is almost always connected to increased body weight or obesity. And that means that the pancreas works okay, but the fat cells become resistant to insulin, and we can't produce enough insulin to manage all the sugar that we eat. Those patients tend to be managed first with diet, exercise, then with oral agents, and then if that doesn't work, then they get insulin.
If there's any family history of diabetes, also that's very important to be established with a primary care physician and check, be sure you are not developing what we call now metabolic syndrome, which in lay terms is like a pre-diabetic and things like that. And control the blood pressure and try to eat low salt. Try to eat a lot of fruit, vegetables, have a balanced diet. If there's any family history, be sure you know your cholesterol.
Diabetes is a pervasive, what we call vascular disease, and it works on the small blood vessels anywhere in the body, the heart being one of them. And we've certainly found that getting more towards a normal body weight, exercise program, and glucose management reduces those risks.
You'll find more information about the Waterman Heart Center when you click the Diabetic Heart story link on our homepage at yourhometownhealth.com. While we're focusing on diabetes awareness this month, last month was National Heart Health Month. Hometown Health attended Florida Hospital Waterman's annual Cardiac Wellness Fair, Love Your Heart for Change.
Very important to exercise at least 30 minutes every day. Even if you don't have a gym membership, even just going outside, walking around the block. It's important to know what our heart rate's doing while we're exercising. Everybody has a resting heart rate, and a resting heart rate is when you wake up, you can check your heart rate, and what it is at rest is your resting heart rate. But then you should exercise at least 30 beats above that resting heart rate. And some of the risk factors for heart disease is if you're a smoker, that's a risk factor for heart disease. If you have high cholesterol problems, and if you have high cholesterol, exercise will make your cholesterol levels lower, so that's why exercise is very important. Also sugar. If you're a diabetic and you have issues with your sugar being too high, you can actually exercise and that helps with your sugar levels. A lot of people are depressed. They have depression issues, stress management, and exercise helps with that. It creates the endorphins that make you, it's like your happy pills, to be able to exercise and you're in a better mood. Florida Hospital Waterman just wants everyone to be healthy and take care of their heart.
The fair not only highlighted the importance of cardiac wellness, but also focused on food, nutrition, and diabetic education.